Mr. Mitchell, is it okay if I lay you down some?
Yes.
So we're gonna lower the head of the bed. But we're also gonna bring the bed up to a working height. Lower the side rail. Can I get you to come closer to me, please? Can I get you to turn away? You're welcome to grab onto that rail. Thank you. Try to keep your resident covered as much as possible during the skill. And now I'm gonna roll this bottom fitted sheet in. And then I'm going to push, 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 push and push. If the mattress was sold, you would raise the side rail, then go get you a washcloth, a towel. You can cleanse the mattress and dry the mattress. And another technique I like to use is I would push a dry towel under the patient. That way there's no way that my new linens could be contaminated by the old linens. And so if you need a demonstration on that, just let me know, put it in the comments and I'll make that video. But for your state of Florida examination, there will be nothing on the mattress, so you can just proceed. Let's recap. So far what I've done is I have safely gotten my patient onto their side. I have rolled in the dirty bottom sheet and I maintained privacy throughout. Now I'm going to start applying our fitted sheet. Check on your resident to see if they're okay. Mr. Mitchell, how are you doing?
I'm doing good. Thank you for asking.
And then work your way up towards the top of the bed, making sure that the corner of the fitted sheet aligns with the corners of the mattress. And then tuck whatever material you need to tuck under the mattress. I like to roll my fitted bottom sheet. Clean and your dirty sheet, they can meet, but they should not overlap. So I have no wrinkles. All right, Mr. Mitchell, I'm gonna lay you back. You still doing okay?
Yes, I am.
Can you center yourself in the bed for me?
Yes, I am.
Okay, so what I like to do now is I call this demummifying my patient. I don't want to get him wrapped in these sheets. So what I'm going to do is I'm going to just release the top sheet at the foot. And I'm going to bring this fold of the sheet over. So now I have a clear view of my dirty linens. And I'm going to ask my patient to come towards me. Can you come towards me? And so you'll stay on your back. Just bring your whole body towards me. And now turn away. 1, 2, and 3. Great. Make sure you keep your resident covered as much as possible. Fortunately, our patient has on pants, so their bottom isn't exposed. But if that's not the case, if your resident has on a gown with no underwear, with no pants beneath, just make sure you pull that top cover over a little bit more. So now we have to remove the dirty fitted sheet. I'm going to lower the side rail. When we're removing our dirty linens, we don't bring anything towards our uniform. We roll it away from us. So watch me. I'm going to roll it in and then roll it away. Every few minutes, just check on your resident. Mr. Mitchell, are you still doing okay?
I'm good, thank you.
And of course, this is going to go in our laundry basket. So now we have to pull down. We have to pull this fitted sheet so that it fits the mattress. And then don't forget, we can't leave any wrinkles. So let's do it together, team. We're going to pull taut. And we're going to lift the mattress and tuck. Pull taut and tuck. And keep doing that all the way. Pull taut and tuck. Pull taut and tuck. This is what it should look like. Your patient should not be laying on wrinkles because wrinkles cause bed sores. All right, let's get our patient back onto his back. Oh, Mr. Mitchell, you're doing such a great job. Let's get you on your back. Let me get some of those wrinkles out your gown, and you can center yourself in the bed. Okay, for this next part, you don't need to lay flat. Okay, I'm going to raise you up just a little bit. You still doing okay? Good. Now that we have our patient centered in the bed, what I've done is I have raised this top dirty sheet. I don't want to totally expose him yet. As I'm preparing the new top sheet, what I'm going to make sure of is that we have a clean area to unfold. So watch as I unfold now. And I've already set Mr. Mitchell up. If you think about the elderly population, a lot of them do not like to lay flat for long. So you had them flat while you were changing the flat fitted sheet, but you can sit them up a little bit because the hardest part of this skill is now done. So I like to allocate some of the top sheet over the footrest because this will allow me to tuck the top sheet and to make my miter corner. Now, before I go any further, I just want to make sure that it is even on the side. So this skill requires you to do a lot of backwards and forward, but it's going to be worth it because your patient's going to have clean linens, and that's going to help them sleep better. Okay, and so now that my top sheet is halfway in position, what I like to do now is I like to make a tent. Imagine there are some visitors in the room or a family member who wouldn't leave. I'm going to hold the clean top sheet up with one hand and then remove the dirty sheet. Once the genitals are covered, once their private area is covered, I go ahead and then I take two hands and I remove this top sheet that was dirty. Don't bring it towards your patient's face. Bring it away and put it in the laundry basket. If your gloves are obviously contaminated, of course you could change them, but remember for your test, we're going from semi-clean sheets or clean sheets to more clean sheets. So thank you so much for your patience. I'm sorry it's taken longer than anticipated. We're just making sure we're training future healthcare professionals. All right, so let's prepare for our miter corners, or you can also call this your hospital corner. I'm going to lift one half of the mattress and tuck. Repeat that process on the other side. Lift half of the mattress and tuck. Now that we have the top sheet tucked at the foot, repeat these words with me. Up, tuck, down. I'm going to undo that. So, top sheet is tucked at the foot. I want you to bring the first layer up at an angle, make a V, tuck the part of the sheet that's nearest the mattress, and now bring it back down. That is how you'll get your mitered corner. Up, tuck, down. I'm going to repeat that process on the opposite side. Up, tuck, down. As a reminder for the Prometric CNA examination, you do not tuck the top sheet along the sides. If you do so, that would be considered a restraint. So you only tuck at the foot of the bed, but then to make sure that your patient or your resident has room to wiggle his or her toes, just make a little tent and ask them to wiggle their toes, wiggle, wiggle, wiggle. And if they can wiggle their toes, we also know they have enough room to move their heels, and that way they're going to be less at risk of getting a pressure sore. And so we had 3 linens that we needed to change. So far we've changed the bottom sheet and the top sheet. Don't forget to change the pillowcase, you all. That's one of the easiest ways to not be successful on your CNA exam. So top sheet, bottom sheet, pillowcase. Let's get that done now. Mr. Mitchell, can I get you to raise your head for me? Thank you so much. As long as you don't shake the pillow out of its case, you're doing a good job. I need for you to keep being patient. Remember, if you get this skill, you will more than likely have upwards of 40 minutes to complete your test. So don't rush. You can do it. All right, I'm going to simply grasp the pillow, and then with just pulling, I'm going to remove the case. I'm not going to shake. And this goes where, everybody? On the floor? You're right, laundry basket, which I have right here. In most of your test sites, you can either put the pillow towards the foot of the patient's bed, or you can put it on the bedside table. Do whatever you feel is best. For video purposes, I'm going to put it on the foot of the bed. Now I'm going to prepare my pillowcase. What I like to do is, you can scrunch, but the end goal would be for you to be able to see the internal seam of the pillowcase. So once you can see the internal seam of the pillowcase, I like to go seam of the pillowcase to seam of the pillow with the tag side inside of the pillowcase. So let's go seam to seam. You all follow me, seam to seam. Lift the pillow and pull down. How easy was that? I didn't shake, and I did not put my arm all the way in the pillow. So seam to seam. I want you to practice it at home. And now, even though it's not a requirement, we usually tuck. I call it making an envelope. And so the way I'm going to do this is I'm just going to lay it down so you can see it better. I'm going to tuck one end of the pillowcase in onto itself, then tuck the next end. So this is what it's going to look like, okay? Mr. Mitchell, can you raise your head? All right, yes, sir, you can lay back now. Let's take off these gloves. Do you remember how to do so? Yes, that's right. We're going to pinch about 1 inch beneath the cuff. We're going to pinch and pull off. And now how do I take off the second glove? Yeah, I'm going to take 2 fingers. I'm going to go under, remove, and then pull off. I'm going to discard of this in the appropriate waste receptacle. So once my gloves are off, I need to go wash my hands, but I have to make sure my patient is safe first. So I want you to tell me, what do I do now? You are so right. That's right. I have to lower this bed down to its lowest position because right now it's up at a working height. This would present a fall hazard. So let's lower the bed down. Great. Now, do I just wash my hands and leave? Or am I forgetting to give my patient something important? Yes, I need to give him his call light. All right, Mr. Mitchell, here's your call light, okay? Just call me if you need anything. Do you want your glasses back?
Yes, please.
Okay. All right, here you go.
Thank you.
You're so welcome. Gonna put your bedside table here. When I come back in the room, I'll bring you some water, okay?
Thank you.
You're welcome. And as we do with every skill at the end, our patient has the call light. They are comfortable. I'm going to go wash my hands. I'm going to open up that privacy curtain, and don't forget to document. And so everybody, this is Nurse Eunice with Florida Training Academy. Yes, I have a workbook that's out that covers all of these skills. You can get that book by going to booksbyeunice.com or just looking for the link in the description area. And I'll see you in the next video. All right, Mr. Mitchell, I'll see you during our next rounds.